Hello and welcome to Niaga Spotlight with me, Tamina Kaushi. Niaga Spotlight goes through the week in economic analysis as well as future affairs. Well, today on Future Affairs, we're looking at a very interesting issue indeed, which is of course costing the silent threat of obesity. So let's set the landscape first with a couple of insightful data points to actually impress upon us all how urgent this issue is for the general well-being of the Malaysian public as well as national development. Now, non-communicable diseases or NCDs in Malaysia are a growing healthcare burden with a number of associated health issues as well as economic costs. In fact, the annual cost of healthcare for NCDs, including hospitalizations, medications as well as primary care, is estimated to be at somewhere around 9.65 billion ringgit annually. Meanwhile, the cost of disability and loss of healthy life years is estimated at around 100.79 billion ringgit as well. Absenteeism, and this of course affects workplace statistics, due to NCDs cost the Malaysian economy around 2.6 billion ringgit annually. Now, from these common NCDs, obesity is one of the most significant health threats, with nearly 20% of the wider population currently classified as obese. Now, according to the World Obesity Atlas, this figure could rise to 41% in Malaysia by 2035, which is not too far off if preventive action is not taken. On Niaga Spotlight today, we focus on immediate strategies to address this growing silent threat of obesity, which also burdens the national healthcare system as well as national productivity levels. Joining me now in the studios, I have the absolute pleasure of introducing Dr. Foo Yok Loong, consultant cardiologist and internal medicine physician with Sunway Medical Center Velocity, SMCV, as well as Dr. Lim Kim Piao, consultant endocrinologist and internal medicine physician with SMCV. A very good morning. Welcome, doctors. How are you both doing?
Okay, very good morning. Thank you for the kind introduction.
A very good morning. Thank you for inviting us for this.
Thank you. Fantastic. So perhaps I could get started off with Dr. Lim, since you're the endocrinologist.
Sure.
So basically, can you give us an overview of what the landscape is looking like as far as obesity goes in Malaysia, coming from our latest statistical allocations?
Sure. Thanks very much for the questions. According to the National Health Mobility Survey that carry out in every 4 years, that is 2023. Right. They have a new data on to confirm that there is 4 NCDs, the non-communicable disease, including obesity, diabetes, hypertension, and cholesterol level. There is 1 million. That means convert to 2.5% of the Malaysian population has all 4 NCDs, and if we take 3 out of 4. There is about 10% of Malaysian populations got 3 NCDs. Right. So for your information, obesity is defined as BMI more than 25. Okay, and this data is really alarming to all of us, and we need to put into our attentions on it and how to prevent and treat these conditions.
So those are some very interesting but also sobering numbers coming from you, Dr. Lim. I'd like to move into asking Dr. Foo a bit of your perspectives about how actually the linkage between obesity to other NCDs, the burden of which many Malaysians bear from a very early age, including cardiovascular disease as well as diabetes.
Correct. So I think that's a very interesting question. So obesity is part of the NCD, and of course we have to understand that is what we term the silent killers. So silent killers, for example, are the diabetes, hypertension, and dyslipidemia, which is high cholesterol. Usually these are all the 3 risk factors which are the mother of all illnesses. So with all these risk factors involved for the patient, we know that they are higher risk of getting a heart attack, a stroke, kidney damage, which will all be a long-term complication and problem for the patients. A little bit added from the NCVD and also the health survey. Sure. So we also have to aware that a lot of our population do have these silent killers, diabetes, hypertension, and cholesterol. It's just that a lot of them are unaware that they are having these illnesses. So, and from the survey itself, they also found out if those people who are aware that they have a diabetes, hypertension, and cholesterol, most of them are not treated till goal. So our aim is actually not only to diagnose them, is to ensure that whatever treatment they achieve, whether it's medically or diet or exercise, they will achieve certain targets which we want, so that in order to prevent them from having complication in the long run.
Absolutely. I really hear you on the fact that you're calling this the silent killer. Would it be appropriate to term and phrase obesity as a gateway indicator for potential for such future diseases?
Definitely. So obesity is definitely one of the risk factors. So when we talk about risk factors, we can coin them into modifiable and non-modifiable risk factors. So for example, non-modifiable risk factors are things we cannot change as an individual. For example, age. Definitely every year we will go older and older, our risk factor goes higher. So whether you're a male or female, if you're female, whether you're pre or post-menopausal, because after menopause, your risk factors again increases.
Right.
So these are things we term non-modifiable. So the modifiable are things which we can change as an individual. For example, healthy lifestyle, exercise, smoking, and then weight loss, obesity. These are things we can change as an individual. And even though if you have diabetes, hypertension, cholesterol, if you are treated till goal. So I think the most important magic here is treated until goal, then the risk factors will reduce dramatically in the long run.
Absolutely. So all about risk reduction as well. Thank you for that, Dr. Fu. Now, Dr. Lim, going into a little bit deeper and thinking about how Malaysians and their awareness when it comes to health risks related to obesity, is the level of awareness still quite low, or have you seen significant shifts in the past few years?
Yes, that's a good question, because besides saying that treat to the goal, we need to aware and diagnose. So before saying that you have diabetes, we need to diagnose this is diabetes.
Right.
So before you diagnose diabetes, the patients or the population need to go and test for the sugar, take blood or take blood pressure or weigh themselves. If they not aware of this, so the treatment and preventative strategy cannot be carried out. So it's a good question. In the past, in NHMS 2019, the diabetes prevalence is 1 in 5, and 2023 is 1 in 6. In 2019, is half of the diabetes patients do not know they are diabetes.
Understood.
But now 2023 is 2 in 5. That means there's a bit of improvement, but it still need a lot of work to do. So I would say that Malaysians, throughout all the preventative measures has been done in the past, have made Malaysians aware, at least aware obesity is not just the numbers, but it can lead to a lot of complications. And have to realize this, obesity is not just the number of BMI, your waist circumference. More than 90 centimeters in a male and more than 80 centimeters in female is central obesity.
Right, understood. So this is also taking into account factors like height, etc., right?
Correct.
But that's a general barometer.
Yeah.
Would you say, Dr. Lim, it's accurate to say that now there is moderate awareness amongst most Malaysians, but there's still limited action when it comes to factors of control to the self?
We will see the hypertension awareness is also 1 in 2 was not diagnosed. So 1 in 2 not diagnosed, that means they are at least 50% of hypertension not taking drugs. So and the complications arise. So I would say that the awareness improved, but it's not certain that level yet.
Understood. Dr. Fu, may I ask you about what you feel has been the interim impact of health and awareness campaigns that are carried out on a mass scale for public information? Is it just background noise, or are you actually seeing some cumulative impacts over the years?
Okay, so I think just now you made a good choice of word action. So I think the awareness is always there. I'm sure everyone knows that the risk factors are always there. Yeah, the risk of getting complications are there, but the action is the one which is lacking in our population, or I could say worldwide, not just in Malaysia. So because for them, they feel that they are well, they don't feel any symptoms, they don't have the diabetes symptoms, hypertension symptoms, so they do not go and do their checkups and check for themselves. They only come to seek medical treatment when they have some complications, and that's where it is sometimes too late to treat them and make sure they have a good quality of life. Because at the end of the day, what we wanted for a patient is a good quality of life.
Absolutely.
So for, I think, awareness part, we are doing a lot better compared to previous. So I think, thankfully, with social media right now, more and more people are aware that there are all these complications and risks. We have seen so many videos of people, sportsmen, actually collapsing and die during certain games. And it makes people more aware and more afraid. So because of these videos and messages which is spread across, most of them are now willing to come and do a medical checkup. And once we do a medical checkup, we are able to detect them early. And again, most of them are more acceptance of the disease and are willing to accept treatment in terms of diet, exercise, or medication. So I think with our government, they are doing a lot of campaign in helping people to do medical checkups. For example, the government, there's a lot of clinic kesihatan which are offering checkups for them. These are good places for people, not patients, people to go and seek treatment and investigation. So there is always a place for you to do checkups. So it's just that the population needs to be aware and go to this area for a checkup. They need to find some time to help themselves.
Absolutely. So I think that step comes first because, well, the medical care system can't come to you. You somehow have to participate and engage.
Correct.
So now let's dig a lot deeper. Dr. Lim, I'd like to go into looking at social and environmental factors that actually impact the prevalence of obesity in particular. Let's focus firstly on urbanization and work culture. From your observations, from the streams of patients who've come through your clinic over the many years, what have you noticed is the correlation between these two factors?
Okay. All right. So if you are talking about urbanizations, one is we are lack of time. A lot of people have lack of time and would like to search for fast food. Not only fast food, you want to search for the food that is juicy, delicious, and exciting, and full of colors and full of taste. Okay. Number two is lack of exercise, because just imagine you stay in condominium and then you take leave and then you drive a car with the jam and you reach company and then you take leave again and sit on the chair for 8 hours. So
the sedentary nature of that lifestyle.
There is no exercise steps, and plus now you search for food via the social apps.
That's
so
right.
In the past, we say that you go to McDonald's, Kentucky Fried Chicken, you need to walk, and you need to take your wallet, and this involves some movement. But now the movement is with your fingers, so there is not much of exercise. And then thirdly is the sleep. Because of the stress and lack of exercise, that of course obesity is prone to anxiety and depression. A lot of our populations are lack of sleep, and then stress. And with the stress, you'll be turned into a vicious cycle. Then you just eat and not exercise. So it is a complex picture if you compare. If we talk about urbanizations, and of course the food industry will aim the food to be much more attractive and high in fat, low in protein, high in sugar, and that make a lot of more complex picture to addressing the obesity in an urban area.
Absolutely. So coming into the factor, Dr. Fu, that also there's plenty of undiagnosed obesity and NCDs, such as diabetes in particular, and heart disease. then there comes the question of those who may not really be that much in control of their workplace culture. I'm talking about those from lower socioeconomic backgrounds, in particular the B40. I think raising awareness, it works up to a certain extent, like what Dr. Fu was saying, but this perhaps is more for the lower middle or upper middle class and those above that, where you're able to take some form of control over what your daily habits are. What about those who may not have that much of autonomy over that?
Okay, I think food per se does not be cheap or expensive. So because we live in Malaysia, and as we know, Malaysia is a food haven.
Absolutely.
So they are food 24/7. I think there are not many countries in the world which offer food 24/7, where you can go out and get the food anytime throughout the day. So, and we know that our taste buds are more towards sweet stuff, towards a lot of saltiness and all these things. These are things where do not need to spend extra money. So of course, when you order a food, you can always try to reduce your sugar, or say, I want a coffee without sugar, without milk. These are things which can help you reduce your risk factors. It doesn't need much. It's just to change your taste bud, so that to accept food which is less tasty, less sugar, less salt, less oil. These are things we can help. So even though if you have gone to a restaurant to eat, there are multiple food choices available. So we just need to be able to accept the food which is more healthier, and not just taking any food you want, which is long-term carries all these risks of diabetes, hypertension, and cholesterol. So for exercise, yes, I think time is of course a limit. But of course, I think now a lot of them has families. So of course, if we can spend time over the weekend instead of going shopping, we can go with the kids to go to the park. I think the government has a lot of extra places for us to exercise. So we have so many parks available in KL town, and of course throughout Malaysia. And sometimes in KL again, we have this car-free weekend where the government blocks all the road in Jalan Tun Razak, Jalan Ampang for us to run and exercise. So these are all free. So it's just that for us as a nation, we need to embrace all this and spend time to help ourselves getting a proper, healthier living. So, and all these things do not need any money. It's just the first, we need to accept them, embrace them, and then go through with it and exercise, diet, and of course, again, smoking is another big issue. Of course, I think government is increasing all the taxes for smokes.
That's right.
We ourselves have to accept that this is bad for us. Of course, again, in the cigarette packs, there's so many complications of cancers and so on. So it's already
right there on the pack.
Yeah, right there on the pack, but still people are still smoking. They may change to vape, but it's still the same thing. So for us, I think first we have to accept, and we have to change ourselves. So it doesn't need any money for that.
Those are some fair observation points, because when it comes to the long-term cost and impact, not just on individuals, but also your family and your support systems, definitely there is a high price to pay. So from there, I'd like to actually go into the factor that the common barriers for maintaining healthy lifestyle, some great steps have also been taken. For example, quite recently, it's been introduced in Parliament that on Wednesdays, no sugar will be served with hot drinks. So it's a start, because this is not something which afflicts a certain segment or demographic of the Malaysian population. It's actually all of us, 1 in 2, right? Okay, so moving in from the 1 in 2 into looking at cultural attitudes in Malaysia. Dr. Lim, perhaps in your experience, what are the cultural attitudes that we actually have cultivated over the years with regards to body image and weight, and how it can eventually also affect and impact mental health, not just physical health?
Okay, if we talk about cultural, Malaysians' culture favor sweet food.
That's correct.
And the food is not just one tasty, it's also need colorful and full of taste. Like Dr. Fu mentioned about the taste buds, not only need sweet, need salty, need spicy, and also need a surge of sugar, because you have to understand, after taking a good food, we feel happy. And your stress level will be reduced a bit, because due to our structural brain, that is endorphin,
the pleasure centers.
The pleasure center, and this can lead to we call it food or sugar addictions. So plus the cultural we organize a lot of festivals, and all the races can come to the same different festivals to enjoy food. So there's some saying that as long as you can provide food to your employees and have a happy hours or etc., you are a good boss. Something this. So our cultural actually make the food restriction and diet control a bit difficult. Let's compare. Let's see our shopping mall. I'm quite surprised, and you are not surprised actually when you see that out of 8 floors of the shopping mall, 25% is full of food, drinks, and advertisement about food and drinks in the social media and the poster, and make the diet control can be difficult. So our cultural, yes, our social factor that making people very hard to lose weight via food, that is a difficult. I'm sure that is a very challenging for them. Yeah.
Absolutely. And the cultural norms around food and celebrations generally also mean that it is then a further level of impoliteness if you do not participate in those social cultural norms, right? So let's talk about how stigma and social pressure, particularly towards obesity, also then impacts individuals who are living with obesity, and quite often without the support structures in place, healthcare or otherwise, then it becomes a vicious cycle. Dr. Fu.
Okay, so I think obesity is something which is difficult for a person to accept. So they understand that they are obese because they know that their body size is that much. So some of them actually do try to reduce weight by exercising, diet and so on. It's just that some of them are unable to reduce the weight to the norms that we wanted. So of course, as all of us know, when there's obesity, we need to help these people. Of course, when you go with them for eating food, make sure we try to order less so that we don't order too much. Because sometimes if you have too much food on the table, everyone will start eating and then they will increase all their weight as well. So of course, when it's obesity, as a friends, colleagues and so on, I think it's a norm also now for us to have a game time for all of them. Can go play badminton, play football, go exercise. We need to help these people by also participating with them, include them in our activities so that we can try to help them as much as we can to reduce the weight. So at the end, it is a two-way situation. First, the person have to accept it. The first person has to embrace it and start doing all this diet control and exercise to try to reduce the weight. Secondly, as a population as well, we also have to help them by reducing the food. When we serve our food, we need to reduce the sugar content, the salt content and so on. So these are two ways of helping all this population indeed. So, but again, if that these people are unable to reduce the weight, nowadays medically there's a lot of other things which can help them to reduce the weight and treat obesity. So for example, there are gastric balloons, there are surgeries, there are a lot of diets which we can help. Of course, even in the government setting, in the government hospital, there are dietitians who are able to help people who are obesity, weight loss program. For example, in Hospital Putrajaya, there's also a support group for them, how to help each other to lose weight. So actually the government already do have all these things in place. So it's just that we need to know where to go, where to seek treatment, and also seek for help as well.
So taking that first step on interpersonal level.
Yes.
Thanks very much, Dr. Fu, as well as Dr. Lim. Yes.
Yeah, can I point out the mental health in among the obese patients? It has been known literaturally that anxiety, depressions, low self-esteem, and lower social interactions is prevalent among the obese, especially the BMI more than 40. So lack of sleep and feel fear to interact with others, and the occupational opportunity is reduced in the patients who are patients with obese. This we need to recognize, otherwise it becomes a vicious cycle. That means they are not very keen to exercise or keen to diet control because easily rebound weight, and they feel very sad and disappointed, and and this is a challenges in the in the patients with obesity.
Absolutely.
So how to address it is, we need to recognize not only lifestyle changes important, genetic plays and very important.
Absolutely.
If your family is has family history of obesity, unlikely you almost is very easily obese because your metabolism is low, and how to address it is you need to work more, to control more, and of course drugs can help, and pharmacotherapy, medications and diet programs, just like the restrictions program structurally implemented and taken care by the dietitians team, and all these structures can help. Just to highlight, reducing weight is not easy. If you can reduce weight, let's say 100 kg, you can reduce 1 kg to 2 kg per month is excellent result.
Absolutely, that's also great progress.
Yes, if you can't, it doesn't mean you should give up. You should identify what is your failure reason and re-challenge again, retry again and again and again, and with the doctors and the medical professions helps.
Absolutely, and I think there's also opportunities, of course, for those who are already part of the workforce, for workplaces to be a lot more supportive as well, considering that basically on average about anywhere between 30 to even 50% of your employees may actually be living with diagnosed and undiagnosed NCDs. Thank you for the discussion so far. We're going to take a short break. Don't go anywhere. We'll be right back with Niaga Spotlight, looking today, of course, at costing the silent threat of obesity. Welcome back to Niaga Spotlight. You're still with me, Tamina Kalji, and today we're focusing on costing the rising and silent threat of obesity. Dr. Fu, so let's go into the fact that there are a lot of pharmacological interventions available today, especially those which are quite often popularized and publicized by celebrities and public figures. And when it comes to the average layperson, it may not necessarily work quite as well or quite as radically. Why is that so?
Okay, I think nowadays there are so many pharmacological available outside. Could be diet, could be injectable, could be medicine. So, but we need to understand that this treatments are not the cure for obesity. It is just the initial phase for them to lose weight. It does help them to lose weight to a certain degree, but at the end, we as an individual need to change our lifestyle, our diet and exercise. Because if we do not change our lifestyle and diet, the weight loss will not that be significant, but we also worry about rebound. We have seen patients who have actually went for surgeries, but they lose weight in the initial phase. But at the end, they do not change their lifestyle. Their diet is the same, they do not exercise. They actually go back to the similar weight as they are, and even higher than what they previously was. Similar with all the pills and injectables and the medicine and diet control which we can. So at the end, these are the initial phase for them. So all the patients need to work hard. It just doesn't mean you have this medicine, you no need to do anything, can continue your diets and so on. So it's just the first phase for them.
Understood, absolutely. And Dr. Lim, if you could share a little more about the increasing burden of obesity and the related healthcare impacts on the younger generation. We're talking about those who are still teenagers even, right? Why do you feel that we're seeing more and more of this, and what are some of the impacts on these young people that you've already witnessed firsthand?
Thank you very much for the question. It's a very important question. As we see, according to the NHMS 2023, the young type 2 diabetes is rising, and we know that type 2 diabetes is due to obesity and family history. Different
from type 1.
And according to the breakdown of the populations, 18 to 29 years old young groups, 85% of the diabetes patients do not know they have diabetes.
Right.
So it's about more than 8 in 10 patients do not know. And we know that when the diabetes progress, the early complications will come very aggressively. For example, heart attack or require dialysis. And we found that the dialysis population is getting younger and younger. And why it is because number one, very importantly, is family history. We found that if you have a father who has diabetes, and you will get diabetes earlier, at least 10 years younger to have diabetes. So if you have grandfather have age of 50 have a diabetes, almost 30 years old you have diabetes. So this is you need to aware. If you have both parents have diabetes, almost certainly you have diabetes and obesity in your lifetime. So the second one is diabetes in pregnancy. So when you have a gestation diabetes mom who delivered diabetes or a baby, so you are pre-metabolically programmed to have obesity and diabetes in your lifetime.
Right.
So if you see the generations progress, it can be very alarming and very scary because our young population who have the 4 NCDs getting younger and younger. And you're talking about productivity, you have young lost life and equivalent to even more loss to a country.
Absolutely.
So I also like to add regarding cardiovascular disease.
Sure.
We know that cardiovascular disease is the #1 killer worldwide. Almost around 1 in 3 individual who actually succumb has a cardiovascular disease. And we are seeing them actually getting younger and younger. So what we have even patients 20 over years old with actually a heart attack who comes to the hospital with a coronary artery disease. So, and some of them we do see that family histories, but also a big chunk of them do not have any family history of any heart problems, diabetes or hypertension. So again, risk factors, as I said, the non-modifiable age, genetic is part of them, but it is not all of them. So we as an individual, we need to know, check up earlier, because even though you are very young age, it doesn't mean you are healthy. It doesn't mean you will have any complication of heart problem, kidney dialysis and so on. So it's always good to have a checkup even though you are 20 over years old, so that we can diagnose them early. So I think, again, this is very important that the population need to understand, aware. Once they are aware, they have to take action to check them early, investigate them early, and if they are diagnosed, treat them early as well.
Absolutely. So it's like a multimodal approach. And now that we've spent a little time discussing with Dr. Lim the impacts on the younger and younger population, let's flip the coin, because at the same time, Malaysia is also a rapidly aging nation. And how is this rising prevalence of obesity amongst the general population actually going to impact our goals as we move towards an aging nation by 2040? Let's cast the net a little further than 2030, which is just about 5 years away. And what are the long-term impacts for the healthcare industry? Dr. Lim.
All right. So we are in aging populations, and we need to thankful to the recent advances in the science and medical. People grow older. So people, even you are with the 4 NCDs, because of the medications and everything, you can live longer.
That's right.
And to treat the aging populations with these 4 NCDs is important to, apart from the lifestyle changes, the medications and the follow-up is needed. Talking about the financials allocated to the aging populations in future, I would say that the financial burden on the aging is getting higher and higher. And of course, with aging, there are more complications, but we still can age healthy. So this is an important message too.
Absolutely, take it away. So one interesting thing is that even the Ministry of Health, the Deputy Secretary General of Finance, Nur Azman Ayub, recently said that the public health service is actually approaching an end of its capacity to independently meet the country's growing healthcare needs. Dr. Fu, how do you see the development going forward, or if there are already some specific developments of PPPs, public-private partnerships, which are helping to meet the increasing healthcare burden that's arising from not just obesity, but the various NCDs directly related to its impact?
Yeah. So I think looking forward in the near future, so we know that the population is getting aging. Our age is getting higher and higher. Now we are seeing patients 90 years old, 100 years old. It's very common in the hospital. And even in the clinics follow-up, they are usually more healthy. But again, their risk of developing all the long-term complication is much higher. For example, kidney failure, cardiac diseases, cancers, they are getting higher and higher. And all this will impact on the government hospital to able to help these patients. So we know that there are multiple hospitals around in the whole Malaysia, but most of them are already at near capacity. If you have been to some government hospital in KL, you know that the emergency department is full. So, and patients sometimes need to wait a long time before they're able to admit to the ward. So in the clinic setting, they're also quite full. Nowadays, I think there's this public-private partnership where government are sending certain cases, certain individuals to the private hospital for treatment. So for example, for any cardiac diseases, I think the government has allocated some budget in the budget for this year or for next year for patients to be sent to the private hospital for investigation and treatment for coronary artery disease. I think this is a way we can help the government in reducing their workload, because we have friends and colleagues in the government hospital are working non-stop, tirelessly, but they are unable to cope with all the patients available there. So I think this, yes, the volume is too much. So I think first we are training more doctors. Hopefully we're training more doctors, the manpower will be there to help more patients. And secondly, the infrastructure. So I think government are building more places and more infrastructure, upgrading them so that they cater to more advanced treatment for the patient. And with this public-private partnership, we are able to help them before they're able to improve the system and also the manpower instead.
Very true indeed. Now, any thoughts perhaps on how basically when it comes to meeting the capacity, which is already existing, Dr. Lim, for the patients who are suffering from obesity and related NCDs, it also does divert critical resources away from preventive measures and other healthcare needs. So how do you feel Malaysia is going to be able to balance that in the most judicious manner moving forth for the next 10 to 15 years or so?
So preventative measures, we call it primary preventions obesity in futures. Firstly, as I say, you still need to recognize identify the danger part of NCDs and start with obesity. All right. So number two is early screening. Early screening that lead to early detections, and after detections, you need early prompt treatment, including lifestyle. And besides that, you need to consistently follow up with the medical system and without any delay or incompliance to drugs and lifestyle changes. So again, treat to the target, as we see, is another important measures. So together, we need the huge measures, multiple measures involving the government policies, and also government hospitals, and also the private sector, NGOs, to create the whole environmental, culturally say no or say slow down of the obesity and the weight. And this is not just one person or one department or one way to do it. It's the whole Malaysians need to put in together to reach the target. Yeah.
That's right.
I think our aim here is to prevent hospital admission.
In the first place.
Yes, our aim is not to get complication. our aim is not to admit to the hospital. Our aim is go to clinics for checkups, go to clinics for follow-ups and treatment. Because if you can treat from the very beginning, of course, we can delay the progression of diseases and prevent complication. Because if you're hospitalized, the cost is a lot more expensive. But if you're being treated for the same illness in a clinic setting from a very early on, then you will not get all this complication and it will reduce the cost to everyone. So I think the government has trained a lot of family medicine specialists. There's a lot of clinic kesihatan clinics available throughout the whole Malaysia, which are able to diagnose early the diabetes, hypertension, cholesterol, treat them early before they get complication. So I think our aim is not to prevent admission. Our aim is to prevent admission and to treat early. Because if not, the cost of healthcare for the entire population will balloon up drastically.
Absolutely. Dr. Fu, Dr. Lim, thank you very much for a most insightful conversation and discussion, focusing, of course, on all things obesity and how we can take not just a social but an economic and cultural approach to reducing it.
Okay. Thank you very much.
Well, that's all we have time for today, so it's quite clear that when it comes to costing the silent threat of obesity, it's necessary for not just systemic changes but also a structural approach towards reducing stigma and addressing it in a timely fashion so that we are able to address the life cycle impacts, including escalating social welfare costs, which will of course impact national productivity as well as development. I'm Tamina Kausji, signing off for now. That's all the time we have today on Niaga Spotlight. Here's to a productive week ahead. We'll see you again next week.